Welcome to Brungart Law's Lanyap, where we provide you a little extra perspective through conversations with individuals from all walks of life. I'm Maurice Brungart, your host. I enjoy engaging with experienced, knowledgeable, and passionate individuals for the opportunity it affords to broaden and deepen understanding of the world through their perspectives. These interactions also offer insights into what makes for effective practices and policies, enabling productive decision-making in our own lives. The more we learn, the more likely we can avoid common pitfalls, become better versions of ourselves, and guide others towards the same. Today's guest that we're going to be learning from is Renée Blanche. Originally from Baton Rouge, Louisiana, Ms. Blanche is the Chief Executive Officer for Ozanam Inn. Ozanam Inn originally was the St. Vincent's Hotel and Free Labor Bureau, a hospice and job-finding agency that ministered to thousands of unsheltered and unemployed who lived in or passed through New Orleans at the beginning of the 20th century. Ozanam Inn has been a haven for the unfortunate who are homeless. Over the years, Ozanam Inn has sheltered hundreds of thousands of individuals and served several millions of hot meals. In the city that care forgot, Ozanam Inn offers temporary respite to those in need. And this year, it is celebrating 70 years of operations. Welcome to the program, Ms. Blanche.
Thanks for having me.
Well, it's a privilege again to have someone of your caliber here. Well, let's just get right to it. Tell us a little bit about yourself, where you went to school and, where you were before Ozanam Inn.
Thanks. Okay. As you mentioned, I grew up in Baton Rouge, Louisiana. My parents are both from New Orleans, but they moved to Baton Rouge to raise a family because of a job opportunity my father had. I went to Louisiana Tech. My original career in life was completely different, a totally opposite world of where I am right now. I studied fashion merchandising, and my goal in high school was to be, a buyer for a chain of clothing stores, which I ended up doing. And I moved to Baltimore, Maryland, and I went back and forth from Baltimore to New York on a pretty much weekly basis, to go shop for trends, to fill up our stores. We had 75 stores in the chain that I worked for. It was a great job. I loved it. I got to see so much of the world and the United States. But I will tell you, that is where my eyes were opened to homelessness. When I was walking the streets in New York, growing up in Baton Rouge, and even coming to New Orleans, because this was basically our second home, I never really noticed it as much. But when I was in New York, I noticed it a lot. And it really struck me as something that didn't seem right or fair. So when I was in New York, I volunteered at the Covenant House there pretty frequently. I can't say I went like every week, but I went as often as I could. Typically worked in the clothing room or helped serve meals there. So that was the first half of my adult life. Then I moved back to New Orleans to open a clothing store here. I was ready to come back and be closer to my family. I had a great aunt who was 100 years old that I grew up with, and so I wanted to be near her, and I had a brand new nephew who I wanted to be involved in his life. So I moved back here and opened a clothing store and did that for about 5 years, and then I really kind of pivoted toward wanting to get more involved in the nonprofit world and trying to help folks that are, less fortunate than so many of us. So that brought me to Covenant House, and I worked at the Covenant House in New Orleans for 7 years before moving over to Ozanam Inn.
When did you start at Covenant House?
2004.
For our audience out there, if you could give them a little context for what Covenant House is.
So Covenant House is an international organization, and it's based in New York, but they have, back when I was there were 16 sites, most in the United States, but they had a couple in Central and South America, and their focus is homeless youth, so 16 to 22-year-olds and their children. So at the Covenant House in New Orleans, we had around 100 young adults, and many of them had children. So they all lived at the shelter there. They had, we had a classroom, we had a daycare for the kids, but all the children, all the teenagers and the young adults that were staying there were required to either be in school or actively looking for a job or employed.
And then from there, you transitioned over here to Ozanam.
I did. And so that was in 2012, and I've been here since. My background in the nonprofit world actually was, for up until about a year ago, but it was the fundraising part of it. So I was the director of development at Covenant House and then here for many years. And then about 5 years ago, I was moved into the deputy director position as well as the development director. In nonprofits, everybody wears a million different hats, right? Everybody does a lot of jobs. So for about 5 years, I was both development director and deputy director. And so that kind of, I guess, got me ready for the director's position, which I'm in now.
Fantastic. Well, let's talk a little bit about homelessness in the U.S., since obviously you have significant experience, several years working in this field. Just for our audience out there, we'll start with the first bit of data based on a report from Housing and Urban Development for the year 2024. 771,480 people had experienced homelessness in the United States. And out of that, 150,000 were children, so that is below the age of 18. And 2/3 were men and 1/3 were women. Obviously, those numbers have changed over the years. And there was a point in time, I think it was probably about 15 years ago, we were actually about 1 million in terms of the homeless population. So one can say there have been some improvements, but if you want to take into consideration or for context, the current homeless population in the States exceeds by double in the population of New Orleans. So just for a little perspective there. For our veterans in the audience, the homeless population consists of 32,882 veterans, according to the report. Although there was a drop in 8% from 2023 to 2024, there had been an increase from 2022 to 2023 of 7%. So it's kind of remained steady, unfortunately. Regardless, we have a significant group of individuals out there. From your perspective, tell us the trends that you've been seeing over the years from Covenant House to here at Ozanam Inn. Give some meaning to this data, beyond the numbers, now down to the individuals.
Right. So one of the things that we've noticed when Ozanam Inn moved from a building that we were in for over 65 years about 4 years ago to a much larger building that we were able to purchase. In our old building, we only sheltered men. Women could come and get clothing and food and go to the clinics that we have on site and use that for their mailing address, but we weren't able to sleep women there. In our new building, we have a whole women's floor. We had no idea what to expect when we moved over here. We made it to where it was 59 beds for women and 97 beds for men. In the first couple of years, we weren't seeing a whole lot of women, but we have seen a huge increase over the last 2 years. And that is a national trend as well, that more women nationally, we are seeing more women being homeless. We're also seeing many more first-time homeless individuals over the last about 4 years. My guess is that a lot of that has to do with affordable housing, low wages, underemployment, and just, once again, it costs so much to live places. Just in New Orleans, the fair market value for a one-bedroom apartment is $1,236. The minimum wage in New Orleans is $7.25 an hour. So you do the math, that's impossible. You have to work probably 4 full-time jobs in order to afford a one-bedroom apartment. That does not include utilities, that does not include transportation. So trying to have meaningful employment, full-time employment, is a huge challenge for our population. And most of the residents in the New Orleans area are renters and not homeowners, especially with the African American population. So there's so many people out there now that are paying 50% or more of their income just for rent. And once again, that's just for rent. That's not including utilities, transportation, food, none of that stuff. So
I'm glad you brought that up because one of the things I want to spend time on is misconceptions that people have of the homeless, and one of them does involve employment. That these are individuals that simply need to find work, but based on the numbers you're quoting, basically that's an indicator that, well, even though employment helps people stay housed, it's not necessarily a guarantee, because then you have to dig a little deeper in, well, what kind of employment do they have? And if it's minimum wage, or even if it were double minimum wage,
Right.
it's still going to be quite a challenge. What other misconceptions have you encountered over the years regarding the homeless? And as well as, do you find some of those misconceptions have been mitigated over time, or it's more of a cyclical thing? People start to understand the problem, years go by, and now it's the same misconception surfacing again.
Yeah. I think a big misconception is that, people choose to be homeless. They're lazy and they don't feel like working, so this is an easy way out of having to take responsibility for themselves. And I don't believe that with 1 ounce of my being, because I'm here every day and I see the people who come through our doors and they want to work, most of them. Many of them are not able to work, whether it be from physical disabilities or mental disabilities. But for the most part, they really do want to work, and they want to get themselves back on their own 2 feet. One of the issues is that the longer you're unemployed, the harder it is to get employment, right? So if somebody's looking at your resume and you haven't worked for a couple of years, for whatever reason that may be, you don't have stable housing, you don't have transportation. So the longer you're unemployed, the harder it is to get employment and or meaningful employment. And when I say meaningful employment, I mean full-time employment. Everybody can go get 2 or 3 jobs paying $10 an hour, but you have no health insurance at that point. You're working 80 hours a week, 90 hours a week, whatever it may be. So that's really all you're doing. And you're never going to get ahead that way. You're never going to be able to get that savings account built up. So once again, I think a huge misconception is that the people are choosing to be homeless and that they're lazy. Another part of the problem is, and I'm not saying this for every single person that's out there on a street corner, those folks really do make our job a little bit harder, because people think that that's what all homeless people are doing. A lot of those folks actually are not even homeless. That's what they do just to get some money in their pockets. They might even have an apartment or a house right around the corner, but that's what they do during the day. And again, I'm not saying that's every single person out on the street corner, but for the most part, our clients, the people who come here to us for services and assistance, that's not what they're doing. They're trying to get back on their feet, and they're trying to, get an ID replaced. That's another thing. If you've lost your ID, if you've been homeless for a couple of years and all you have is what you're carrying around with you, you don't have your state ID anymore. You might not even have your social security card anymore. You might not have your birth certificate anymore. All that stuff takes time and money to replace, and you need all those things to get employment and housing and pretty much everything in the world, right, in the States. So it's a challenge that pretty much, again, everybody who walks through this door has. So we work to help them break down some of those barriers so that they are able to get out there and go and look for jobs. But again, we have a bunch of people that are living here right now and saving their money to get their own apartment, but they're working 2 and 3 jobs just to save up some money so that they can afford rent. So I think then, there's the mental health piece of it all, and the physical health care, primary health care. Health care is not easily accessible to people who are unhoused and employed or unemployed. So when your physical health and your mental health care is not being taken care of and addressed, it takes a toll on every other part of your life. So let's just say, for instance, somebody who has been on the streets or didn't have a house that they came from, a home where they came from, where their physical and mental health needs were being addressed, they might not have a full set of teeth. This is just reality. So when they're going for a job interview, they're not putting their best foot forward. They're not smiling. They're not talking as much because they're self insecure. They're insecure,
Yes.
right? So it's a challenge. We've so many people. I can't go look for a job. I'm missing 4 of my front teeth. So there's just a whole lot of, everyone is an individual. Everybody's got their own story about how they ended up in a homeless shelter or on the streets. And it's not our job to judge. It's our job to help them get past some of those barriers that are keeping them in those places.
Regarding some of the misconceptions, regarding substance abuse, I found something I want to ask for your particular perspective on this. So in the data, it was that substance abuse actually was not a significant percentage of the homeless. Do you find that to be the case in the years that you've worked here, that actually many of the people you're encountering as clients are not suffering from substance abuse?
I'm not going to say that we don't have a fair share of our clients and the individuals who come here who do not have substance abuse issues, but it is definitely not the overreaching reason for them having become homeless. I will say that oftentimes becoming homeless and maintaining that status can put people into a substance abuse environment, right? So you're living on the streets and you're in a tent city or wherever, there's lots of drugs. So it sometimes puts somebody who wasn't an abuser, a user even, now puts them in that space. And a lot of times they never had a substance abuse issue before, but the homelessness has brought them to there. But yeah, you're right. It's really not an overreaching aspect of the people who come here and who are seeking services with us.
From the mental health side, if you wouldn't mind speaking again to those that you've encountered, I assume schizophrenia and other mental health issues of that nature play a big role.
Yeah.
I personally have had a friend who has had an adult child, unfortunately been diagnosed with schizophrenia and went from being in an elite university to then finding himself on the street because he was suffering from schizophrenia. He wasn't taking his medication. And then the challenge for his mother was being able to locate him, because since he's an adult, now there are privacy information concerns, and no one could really confirm or deny whether they were actually housing her son. So on that note, what have you seen regarding individuals and mental health?
As I mentioned earlier, mental health is a huge issue for our population. And as you mentioned, bipolar and schizophrenia are often later adult onset diagnoses and or symptoms. I too had a very, 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 very close first cousin who was fine until he was in his early 20s. And then that's when his diagnosis, or his illness, actually, I guess I should say, really started to progress. So we do have plenty of our clients that have bipolar schizophrenia diagnoses. The problem is, where do they go get mental health care? There are very few places to get mental health care, especially if you don't have insurance or you don't have income. And so the charity hospital here does have a psychiatric ward, but once they are admitted to that ward, there's a 72-hour hold, and then they're discharged. And there's typically no follow-up plan for those who don't have income or insurance. So we also have a whole lot of clients here who take tons and tons of medications. And so one thing that we've been really trying to push with our clients is we have clinics here on site to bring their medications to those doctors and those healthcare providers and help them go through and manage their medications. Which ones are you taking? Which ones are you not taking? Which ones seem to be helping? Should we get you on something else? Should we get you off these things? So honestly, it's access to healthcare that is a major barrier for the homeless clients, and the stigma. Even folks who are not in homeless situations, the stigma of mental health care is huge. It's the same for people who are homeless. They don't think that they ever had an issue as far as mental health care, and they're still reluctant to get the services that they need when it is in fact available.
Have you had that experience as, being a part of the operations of Ozanam Inn, having a parent come to the shelter and they're looking for their adult kid?
Yes.
And I assume
Quite often.
Quite often.
Quite often. And as you mentioned earlier, we are not allowed to give out information on our clients. If somebody calls and says, "Is Maurice, tell me your name last name.
Brungart.
Is he staying there?" We are not at liberty to give that information out because it's all adults. We are an adult shelter here at Ozanam Inn. We're 18 plus, and so we do not give that information. The only time we give that information out is if it's a law enforcement situation and they have a warrant. That's the only time we will give that information out. Now, what we typically do is say, give us your information, and if that person is here, we will let them know that you're looking for them.
Yes.
But yeah, we have a lot of parents who are looking for their adult children here. And then we also have a lot of our clients who are not willing to speak with their parents. So that's a lot.
I can definitely only imagine how much it is in terms of the emotional toll it can have on you and your staff, not to mention on the parent trying to care for their kid, despite being an adult or not. Mm-hmm. So then one of the realities that I'm seeing here is if someone has schizophrenia or a severe bipolar disorder, their risk then would naturally increase in terms of being a candidate for homelessness. Again, because thinking back of my particular friend, stable family, well off overall financially, but you can't force someone to take their meds, and if they don't, then they swim out into the ocean, so to say, and you got to wait for them to come back at some point in time.
And the reality of those kinds of situations too is that oftentimes the medications, they might work for a while and then they stop working or they have a different effect. And so psychiatric medications have to be tweaked and adjusted often. And once again, if you're homeless or unhoused and don't have insurance and don't have a primary care physician or a psychiatrist that you go to, how does that work? So you stop taking the medicine because it's not doing what it's supposed to be doing, or it's doing something completely opposite what it's supposed to be doing. So again, medication management is a huge piece to the puzzle.
Speaking of misconceptions, let's shift it a little bit. What misconceptions have you encountered in about 20 years of working in this field that people have of you, the work you're doing, and of Ozanam Inn specifically?
It's an interesting question. I think that it goes back to the misconception of homelessness in general, right? That y'all are people might say, oh, all you're doing is exacerbating the problem by just giving them a hand out. Well, that's not what we do. At least that's not what we do here at Ozanam Inn, and I think most of the service providers that I know, that's not what we do. What we're trying to do is get people stabilized first and foremost, right? And we want to meet their basic, immediate needs: food, clothing, shelter, just the basics that we should all be afforded. And then what we try to do is once we gain their trust, we start working with them to try to figure out what's the root causes, how did they get to this place, how can we help them get past those hurdles that are keeping them from realizing their potential. So I guess to answer your question in a roundabout way, I think a big misconception about people who are doing the work that we're doing is that we're really not moving the needle. We're not making a difference, and we're not moving people from homelessness to independent living. That is absolutely not true. I can tell you at Ozanam Inn, in the almost 14 years that I've been here, is that right? We've housed permanently over 1,000 individuals, many of them on their own because they have income, whether it be earned income or disability benefits. And we probably have, maybe about 400 or 500 individuals who've been permanently housed and successfully permanently housed for over 10 years. So it does work when you help get people to a place where they feel confident, where they feel like they can take care of themselves. They might need more assistance. Some might need more assistance than others, obviously. But when you start breaking down the barriers that people face as far as housing goes and employment goes, then you really are making a difference.
In terms of making a difference, government policies, whether at the federal level, state level, municipal level, again, what have you encountered that actually benefits the homeless and what doesn't?
So I think there's a practice that's called housing first. And what that means is when you take somebody off of the streets or out of a shelter, most typically it's off the streets, and put them into a house, that they're more likely to succeed staying housed. That policy, while it's great, and I definitely agree with most of it, can only work if you have the support services on the back end once that person is housed, right?
And so those support services being
case management, get transportation assistance, rental assistance, all the things that people need to maintain and sustain their independence, right? So again, it's called housing first, and there's a lot of controversy about whether it works or it doesn't work. But again, like I said, it only works if you have those back end support services. And so, again, some people need more than others, but you can't just put somebody in a house and say, bye-bye, see you later, we got you a house, here you go. It doesn't work that way. You're going to have to help them with, again, finding those replacement IDs, documents.
Is Housing First a legislative policy?
It's not a legislative policy, but it is a best practice in the homeless service world. But again, it's a slippery slope on that one, but it works when we do it right. Some of the other policies that really work are rental assistance. There's another program called rapid rehousing, and that's where you help somebody out for X amount of time with rental assistance, and they save their income while they have that rental assistance. We're working on a program right now where it's a 12-month rental assistance program, but the participants have to have income, and they're required to save and have a savings account while they're in that program. The plan is that once that 12-month rental assistance expires, that they are able to sustain their housing at that point because they have income, whether it be earned income, whether it be disability, or a combination of both. So rental assistance is hugely important because, as we discussed earlier, affordable housing, and low income. Those are huge barriers to people being housed. Once again, transportation, as I mentioned before, is an issue. If somebody's got a job that's 10 miles from where they live because that's the only place they can live, and they got to take a bus to get to work, and that takes them 2 hours each way, that's not really sustainable, especially when you got to work all those extra hours and all those jobs. Again, Medicaid and Medicare, mostly Medicaid, and access to health care are huge. Those are policies that cannot be taken away because people who are underemployed cannot afford to buy health insurance.
Your clients here, ballpark, off the top of your head, how many are reliant on Medicaid?
About 100%.
Yeah, I figured as much. So, yeah. Okay.
And we have partner agencies that come here and sign people up for Medicaid. That's all they come and do. We're big on collaborations. We have lots of other agencies and organizations that come in here and offer services, so we can kind of try to be a one-stop shop for folks, and it does really help. Now, our clients need housing navigators or case managers to help them find the right kind of housing for them, because some are not from here. They don't know what part of town to live in. Some people think they can afford more than they can, right? So we have to be realistic with them and do financial budgeting with them and make sure that they know, okay, look, you're you're taking in $2,000 a month. $1,000 of it is going to go to rent. So what are you going to do with the rest, right? So financial literacy and education for the clients is hugely important as well, as is adult education programs. I know that some of the talk is to do away with adult education. Well, a lot of our clients don't have their high school diploma, or even if they do, they have been out of school for so long, or they don't know how to work on a computer. So a lot of these adult education classes might not just be to get your high school diploma, but it might be to help you build a resume, or to how to job search, how to go on an interview. So adult education is also hugely important to get people to meaningful work opportunities. And that's another thing. We need to have more programs, in my opinion, that are geared toward people who can't go. They're not going to be a lawyer. They're not going to be a doctor. They're not going to be an engineer. But they could be an office manager, or they could be a restaurant manager, So we need to have more training opportunities for the adult workforce.
Being careful about establishing perhaps a causal relationship where there is none, but do you see there being a direct connection between someone's level of education and being homeless?
I'm going to say no, because we've had a lot of people who have come through our doors that are doctors and lawyers. I know that there was a gentleman that came through who was a doctor many years ago when we were in our old building, and he lost his wife, and that really put him in a tailspin. And then a lot of times it's one thing happens, and then another thing happens, and it's just it's a rolling effect. One of the first ladies who came through our program here, she lost her house during Hurricane Ida. And then she lost her job because she lost her car and she couldn't get to her job. And so, it was just a spiraling effect. And so one thing after another. I'm happy to say that she is now actually employed here at Ozanam Inn.
Okay.
But I really don't think that education always has to do with people becoming homeless. I think there's so many, as I mentioned earlier, everybody's an individual. Everybody's got their own story. There's so many reasons why people become, maybe their parents were homeless. We mentioned cyclical earlier. A lot of times when people are born into homelessness, it's almost impossible to get out of it, right? And I think we have a lot of people here who have been born into homelessness.
In terms of things cascading, stepping back briefly, now, what are the first impacts that come to mind should people no longer have access to Medicaid?
As I mentioned earlier, when your physical health is not tended to, then it takes a toll on your whole overall well-being, including your confidence. You might not be able to walk to the job that you used to have now because of an illness or an ailment that you have that isn't being tended to.
Speaking of ailments not being tended to, so I'm just thinking of this. What are some common ones you see that basic healthcare can address?
Diabetes.
Okay.
That's a huge one. Hepatitis C. Mental health obviously is a whole different scenario. Heart disease, hypertension. All those kind of basic things that we go to our doctor for and they take care of. People who don't have insurance and can't see a primary care physician on a regular basis or don't have access to easy access to healthcare like we do, then all that stuff just gets so much worse and a lot of times makes people unable to work.
Going back to my original question, what are some policies or practices that, in your opinion, they don't work?
No,
even though they're presented and there are good intentions, but they don't work.
Okay, well, I was going to say the ones that don't have good intentions, like criminalizing homelessness.
Okay.
Putting somebody in jail because they're on the street. That doesn't help anybody, and it actually costs us more money to do that than to have shelter or housing programs to help people get off of the streets. Ones that have good intentions that are not working. I didn't think about that when you asked me. I'm going to have to think on that. Let's come
All
back
right.
to that.
Yeah, we can come back to it.
Okay.
You were obviously working here based on what you've explained. I think you were at Covenant House at the time. But when Hurricane Katrina hit, and I mean, it was just a couple of weeks ago that New Orleans commemorated 20 years from the impacts of the storm. What was the experience like for you and your clients at the time at Covenant House?
Well, it was certainly like none other,
Yes.
and I hope none ever again. Obviously, we had to evacuate the city, so that in of itself is a challenge when you've got a shelter full of 100 people that has to be evacuated, as does your staff, right? So we had to take our kids from Covenant House New Orleans to Covenant House Houston, and which meant that we had staff to do that too. Aftermath. 90% of the staff was homeless, right? Because their houses flooded here. We also couldn't get back for close to 2 months into the city. And so it was a very challenging scenario. And I know that it was the same issue with Ozanam Inn back then too. And then people were dispersed everywhere, right? So even our staff, we were trying to open up Covenant House New Orleans again, but we didn't have the staffing to do it because they weren't back because they didn't have a place to live either. So we did have some of our staff actually live at the shelter post-Katrina when we did finally reopen. Well, that was a whole other story too, because then Rita hit, and in Houston they had to evacuate all the Covenant House New Orleans kids and the Covenant House Houston kids and staff. But thankfully everything was fine there, and they came back. But reopening was a big challenge because, again, of staff and just infrastructure. I mean, the Covenant House here in New Orleans is on the edge of the French Quarter, so the building itself did not flood, and it was in pretty decent shape. So structurally, Covenant House was fine, but internally, and as I said before, staffing, we were not fine, and it was a tough time.
The human resources were basically
Resources.
gutted.
Exactly.
And do you know what the impact was at Ozanam Inn?
I think it was similar. I mean, I know it was similar. Again, all the residents evacuated. However, Ozanam Inn did not take them. They went in city-provided buses. They went to the Superdome. They went to the convention center, and then were evacuated by the city and the government entities that came in. That's how it was at Ozanam Inn. At Covenant House, because we took care of minors, it was a little bit of a different scenario. We were not dealing with adults. So, but yeah.
So when you came back in the aftermath, did you have a moment there where you thought, I don't know if I can continue? Because not only are you still trying to help people in need, but now it's like, well, are we going to be able to open our doors again?
Right.
Did you have a doubt?
Well, I came back 6 days after the storm.
Wow.
Yes, it was pretty crazy. A lot of us had gone to, some of us went to my parents in Baton Rouge. Some of the other staff, like I mentioned, went to Houston. My boss at the time was with me in Baton Rouge at my parents' house, and so was some of her family. So we were able to get back in the city. I won't say how, but we had to get to Covenant House because we knew that our maintenance supervisor had rescued a whole bunch of people and brought them into our facility because, again, it was above ground. He was cooking food with a generator and all that kind of stuff, but he had 47 people inside of the shelter.
So he was running Covenant House.
He was running Covenant House for adults in the city who hadn't gotten out. So we brought a whole bunch of cars and we got everybody out and we brought them back to Baton Rouge to a shelter that they had erected there. Meanwhile,
If I can interrupt you briefly, do you remember that gentleman's name?
I do.
And what's his name so the audience can hear
His
it?
name was Mr. Calvin. What's Calvin's last name? And I know he's still with us. He's not at Covenant House anymore. He's retired. But oh gosh, what's Calvin's last name? But he's an amazing man. And one of the people that he did bring was a quadriplegic, and so that guy was sleeping on the pool table.
Huh.
But Mr. Calvin brought all those folks in because his house had flooded. So he knew that Covenant House was on higher ground. So he left his house and went to Covenant House, so he could stay there because he knew it was going to be on high ground. He lived out in Pontchartrain Park, and he was flooded.
And you say he brought about 40 people back?
It was 47, I believe, that he had in the shelter.
So he could have ducked and run.
He totally could have ducked and run, but he didn't.
He brought in 40 strangers, basically. 47 strangers.
And was taking stuff out of the freezer and cooking for them and running the place all by himself. I mean, I think he had some of his family members that were helping him. But yes, Mr. Calvin's an amazing, amazing man. And like you said, he could have ducked and run. He didn't have to do that, but he did. So they were all very relieved when we got there to take him out, though. And Covenant House is next to a police station. And the city, at this point, again, this was 6 days later. So we had to go all over creation to actually get to Covenant House just because of the water. The only reason we were able to get in is because one of the people with us was a St. Bernard Parish police officer, so his badge got us in. So anyway, the police station next door didn't have a whole lot of resources, so we brought them some water and some snacks, and it was, crazy hot outside. They were wearing bulletproof vests because there were stories about snipers and all kinds of stuff.
Yes, the
in
rumor
city.
Mill and the exaggerated stories of violence.
And so, which they did not know was exaggerated. They
No,
thought it was
no.
reality, right? So they were all very on, very tense, very on edge. In fact, one of the police officers actually pulled a gun on me, but I didn't blame her because she was stressed beyond belief. And I said, we're here to help. I did try to get to my house at that point because it was taking a long time and I didn't live too far from Covenant House, but I wasn't able to get there. I did see a deceased person on the neutral ground, however, so that was pretty crazy. So yes, to answer your question, I was like, we're never going to get back here. We're not going to be able to do this again. And again, this was right after the storm, so it was pretty scary.
Yeah, and don't get me wrong, when I ask if you had a doubt, not a doubt about your willingness to continue on, but more the fact it's like you have that doubt, I don't think we're going to be able to recover, and it really makes no sense to invest anymore. But then getting past that.
Yeah. I don't know that I really ever had that doubt about New Orleans coming back. Everybody keeps saying, we're so resilient. We are kind of tired of hearing that, but it's true.
Yeah.
It is true. And we're still not completely recovered from Katrina, obviously. But it was also very, it was emotional and it was very heartening to see how many people came together to help each other. And people weren't just helping to clean out their own houses. They were cleaning out other people's houses. Their house was trashed, but they were helping their, down the street person clean out their house. And so it was a beautiful moment. And so many people came from outside of New Orleans to help. In fact, I have a very, very, very dear friend of mine who I met because he and his brother came down from the Baltimore area. I didn't know him. I lived up there before, to help out during Katrina, and they ended up at Covenant House, and we're still great friends. And so it was really beautiful to see how many people came to help and how many people who are from New Orleans and lived in New Orleans really stepped up to just offer each other a shoulder to cry on and a back to carry a refrigerator on,
Let's get into the nuts and bolts of Ozanam Inn. Let us know, how does this place work? What are the resources you have available for the homeless? It's my understanding you have over 150 beds here for men and women. But again, what you're offering, and also who's helping provide that?
Yeah. So we have a total of 156 beds here. We have a separate men's floor and a women's floor. So we have 97 beds on the men's floor, which fills up every single night, and 59 beds on the women's floor. We have 22 staff members, 7 of whom actually came through the Ozanam Inn program, and really just felt like they wanted to give back because of what Ozanam Inn had given them. Of those 156 beds, about 30% are people who really want to kind of take that step further and not just sleep at a shelter, but they become one of our residential program participants. And that means that they have a permanent bed here, they have a case manager, and for the bulk of them, they work within Ozanam Inn. So they work in the kitchen, or they work in the office, or they work in housekeeping. They have a supervisor, manager that they report to. They have a specific schedule that they adhere to. They have 2 days off. All of their other, everything is free here. We don't charge anything to anybody to stay here, and we don't allow any of our partner agencies that offer services to charge us either, right? So those people who are on the program, the program is meant to help people get back to a structured environment. And, by meaning you have to get up at a certain time, you have chores in your job that you have to take care of, you have a manager to report to. So really just kind of try to get them back on their feet and ready for when they're moving out of here and they have that job. And they take pride in their work too. They make sure that the bathrooms are sparkling clean, or that the meals that are served here are, prepared with care. So again, we offer 3 meals a day. We have nightly shelter. We have case management. Anybody is allowed to use our mailing address for their address. So, if you're homeless, obviously you can't really afford to go get a post office box or get to that post office box even if you have one. So people are allowed to use this for their mailing address, and lots of people do that. We have 4 partners, who do healthcare clinics here. LSU and Tulane Medical Schools, LSU Dental School, and a local agency called Healthcare for the Homeless. Between those groups, they're here 4 days a week offering healthcare. We also have Metropolitan Human Services District, who's going to be coming back to offer psychiatric care for our clients. We have an adult education center that is run by partner agency Hope House, but it's here on site. All these services that I'm mentioning are here at our facility on Poydras Street. So once again, we really try to offer as many things as possible for people to come here and really try to work with, getting themselves back on track and back on their feet. So we help with replacement IDs. As I mentioned earlier, most of our clients don't have their social security cards or birth certificates, all those things that you need to pretty much get anything. We have visiting attorneys who come to offer a little bit of legal advice, but mostly do like notary services. What else? There's a lot.
The support system behind that. So you mentioned the individuals, your staff.
Yep.
But like before, when you were showing me the facility, you shared with me the fact you recently had to replace not 1, not 2, but 6 HVAC systems.
Yep.
I assume that comes at a substantial cost.
Absolutely.
So your funding,
Yep.
Where does it come from?
A variety of places. We are mostly not federally funded. We get a small amount of money from the city to just provide operational assistance, but it doesn't amount to a whole lot. So we write a lot of grants. We have lots of individual donors who've been giving to us for many years, and we're working toward getting more of those. We haven't done like a big fundraising event in a while. We had to stop what we were doing before COVID, and then COVID hit, and so we really had to stop. So we're working on trying to get another event going to raise some money there. We are out in the community as much as possible, going to do speaking engagements to different organizations, whether they're civic groups, religious groups. We're trying to do everything we can. We're all over the place as far as funding goes,
Do you find fundraising for a nonprofit homeless shelter is more difficult than, say, fundraising for other causes?
Absolutely.
And I don't want to identify any others at risk of sounding like I'm criticizing them. But I assume it's much more difficult in this line of work.
Absolutely. Even a difference between me coming from Covenant House to an adult shelter, right? Because at least those were kids.
Yes.
So that's a little bit easier because they're kids, right? So then now I'm in an adult environment, and goes back to what we talked about earlier, the misconceptions, and that a lot of people think that people are choosing to be homeless. So a big part of our job is education and trying to help people understand that nobody woke up when they were 5 and said, I can't wait to go live in a homeless shelter. Nobody said that. So it's really an abundance of just trying to get people to understand the different scenarios that put people in this space. As I mentioned earlier, we have 7 people who are on staff who came through our program. So, that to me speaks volumes about what we're doing here and how we're helping people, because they all decided they wanted to work here because they wanted to give back to where they had gotten so much. So when I can bring any of those folks, or even somebody who's on our program right now, to speak to people, because I've never been homeless. So I can talk about it all day long, but if I can bring somebody who's been through that, who's actually got lived experience, they can really see, feel, touch, understand a lot better about what homelessness really is. And so, yeah, it's a lot harder to show people. But I will tell you that I think there's so many good people out there that really want to help and really want to help people and don't want to see people sleeping on the streets and don't want to see people having to eat out of garbage cans. And so there's a lot of people that really do want to help. So, yeah, we're all over the place, like I said, on fundraising.
From a pragmatic point of view, going beyond this being, say, the ethical thing to do, the moral thing to do, pragmatically speaking, why should someone fund Ozanam Inn? What, if they were to look at it, what's in it for me?
Well, what's in it for you is that there's people not sleeping on the streets, and there's people not roaming, your neighborhood. When we were moving, there was a whole big, where can we put a homeless shelter, because there's going to be backlash. Well, you're not putting it in my backyard, right? So, it was a very strategic move to come where we are here, because it's not really in a neighborhood. But the reason to fund a place like Ozanam Inn is because it's a lot less expensive to have a place like Ozanam Inn and housing programs than it is to put people incarcerate people or have people out on the streets that are then maybe going to perpetrate a crime. I'm not saying they're going to, but that's a perception, obviously. And so, who would want to see somebody sleeping on the street when they know that they could give to a place like Ozanam Inn that is providing a safe, secure place for somebody to rest their head at night, who's not as fortunate as those of us who, came from a good family that had all the resources we need growing up, or even a lot of the clients, as I mentioned before, that come to us did have that, but whatever happened put them out on the streets. So I would say, why fund something like this? Because it's better for our community as a whole on a number of different levels. Nobody really wants to see somebody begging on the side of the street. If they have a place like this to come, then they're less likely to do so. And they're more likely to have the other resources that can get them back into being a productive member of society, giving back, contributing back, working, tax-paying individuals.
True. And I would take it that also if someone's out on the street, and because everything that could be associated with that, whether it's the police taking the individual and relocating them, even if they're doing that person a solid, they're bringing them to Ozanam Inn. Hey, that's just up the street. Why don't we take you there? But at that one moment, it's a diversion of taxpayer-funded resources, and for that one moment, then the police are not doing their job of law enforcement, so to say. And I assume there are other areas we could, if we were to dig, where there are going to be resources that are now focused on addressing this, whereas it would come at a lesser expense if y'all are being properly funded, right?
Yes.
Okay.
And then we could definitely go deeper into
Yes,
into all
yeah.
that, but there's a need, such a need for places like this, but there's such a need for other places as well. We have a lot of hospitals that send people that they're discharging to our facility who should not be being sent to a homeless shelter. There really needs to be another.
So that might be going back to what we were discussing before, a well-intentioned practice.
There you go.
That's not
because they
really
can't
working.
discharge them to homelessness, right? So they have to discharge them somewhere. But we get people who are sent here all the time who they can't walk. They can't take care of themselves at all. So unfortunately, a lot of times we have to send them back to the hospital because there's no other place for those folks to go. But yeah, it's a complex situation and a complex problem. But there's pieces and parts that everybody can do and contribute to. We can't be everything to everybody, but we can be a lot to a lot of people, but we need other people and other organizations and other entities to step up and help, fill the gaps and help us take care of those folks that we're taking care of.
From your time in the fashion and clothing industry to now in the nonprofit world and now occupying a position of both leadership and management, what are some of the things you found have been useful from your previous experiences that you've been able to translate here? And for anyone considering this type of work, what they need to keep in mind that's going to make their impact much better in terms of decision making. The skills one needs. I mean, are the skills easily transferable from, again, a capitalist industry to a nonprofit world? Do they flow well, and they just require some tweaking, or is it completely different?
So I think in any line of work, you have to be open to different ideas and different opinions, and you have to listen. And I think back in my fashion world days, sometimes I was a buyer. So let's just say one of my vendors would say, you should buy this. It's really one of the best trends. It's selling like hotcakes. And I hated it. And I'm like, oh, I think it's terrible. It's ugly. But I might have gone out on a limb and listened and said, okay, they might be right. Let me listen. I don't know everything. So I think, again, listening is always a key. And we don't know everything. I think being open to different ideas and different thoughts. And that's one of the reasons why I love all the different partners that we have here and the collaborations that we have, because I can see things through a different lens. And I think that's very important. And I also listen to our clients. If they say, Ms. Renee, I think we should do this, or we should have this service, or we should stop doing this like this and do it a different way, I'm always going to listen. It might not be right. It might not be feasible, but it's happened many a times where a client or a resident or a staff member has said, how about we do this? And we've done it, and it's worked a lot better. So again, I think openness, listening, taking in different perspectives is always important in any profession. And that's something that I've always tried to do.
I brought this up before we actually started the podcast, that I was intrigued with your mission statement, and that it's actually quoting Saint Frederick Ozanam. And I'm going to read it out to the readers. Yours must be a work of love, of kindness. You must give your time, your talents, yourselves. The poor person is a unique person of God's fashioning with an inalienable right to respect. But that's just the first half. The second half of the mission statement is, you must not be content with tiding the poor over the poverty crisis. You must study their condition and the injustices which brought about such poverty with the aim of a long-term improvement. Well, this is quite interesting, considering it's coming from the 19th century, and the individual is realizing there's, again, just more to it than just that particular person. And you yourself and Ozanam Inn, you're principally focused by nature of the beast, I would say, on the first part. But, what would you propose to the audience to consider in terms of that second part? What is creating these conditions? As a percentage of our population, our society, one can make an argument that the homeless population has remained steady, all things considered. But I would say perhaps one should be careful about becoming complacent about those numbers. So what would you comment on regarding this? Looking beyond that individual and the root causes, what do you find would be ultimately successful? And I don't want to say in an ideal world, but if there happen to be any politicians listening, what would you want them to know from your perspective?
Well, I've said it a couple of times throughout our conversation, but just access to, better education, access to healthcare, transportation is an issue. But again, like the second half of this mission statement says, you really have to look past the shell of the scenario. You have to look deep inside. What's happening? What's going on? How did this person end up here? And I will say it again, like I've said multiple times, each individual has a different story, but there is an overarching common thread, most of which is education and lack of quality education. I will tell you, look, like in New Orleans here, I don't understand how parents can navigate where they're supposed to be sending their kids to school, because schools open and close left and right, and so there's no neighborhood schools anymore. People don't go to neighborhood schools. And I'm talking about public schools. I'm not talking about, parochial private schools. So a lot of kids, and this is newer, I think, and obviously homelessness and poverty has been around for a long time, but, one kid might be going to a school for a year that has to move to another school, then that school closes or moves and they got to go to another school. So that, quality education is always going to be an issue. Healthcare is always going to be an issue. Transportation is always going to be an issue. But more than anything, it is being able to afford to put food on your table and a roof over your head. How do we get to that point? That's a long ask question that I'm not going to say I have all the answers to, but I think if we start with the understanding that we really need to try to give people resources to make the best of their lives, then we're going to see a better outcome.
Regarding the mission statement, how do you define success, that you're achieving the mission?
There's a lot of different ways for that.
Okay.
Just seeing smiles on people's face, knowing people that people are not sleeping out on the street in the elements, knowing that we've been able to get somebody to come into our shelter and off of the streets, that's a success, obviously. When we move somebody into housing, and they come back and visit and they come back and volunteer, those are beautiful moments, and we have a lot of that. And there's this guy he came through our program a couple of times, but he now has full-time employment, and he's been employed and housed for over 10 years, and he comes back probably about 4 times a week to volunteer. He carries around a sign saying he will work for food, because we do feed him when he comes. But he's great, and he's a great mentor to the folks who are in our program right now too. Another success is when we have somebody who's been just sleeping here every night, and they finally decide they want to get on the program because they want to take that next step. They want to have that security and that structure and have that case manager and kind of work toward getting to their end goals, which hopefully is independent living and self-sufficiency. It can be as simple as somebody reuniting with a family member that they've been on the outs with, because now they've gotten a little bit better perspective of where they want to be. Maybe they're not as angry as they were 5 years ago when that happened, or 10 years ago when that happened, because they've been shown love and respect at a place where a lot of people haven't seen love and respect. And so I think again, when I see people smile, when people say thank you, when people say, I really appreciate what y'all are doing here, and show it by moving their lives to the next level for them, right? It's not about us. It's not really about what we're doing here. It's about them taking advantage and taking advantage of what is here and using it to the best of their abilities. When I see the adult education center filled with 10 people, that makes me so happy. Because maybe not all of them are, like I said, getting their GED, but they're looking for a job, or they're writing their resume, or they're communicating with a family member via email or something like that. So there's a lot of different ways to say what makes my heart smile.
When you talked about your clients taking advantage of the resources you have here to pursue adult education or apply for a job, I was going to ask you, what you saw as obstacles leading the staff here managing Ozanam Inn, but touching upon technology. Do you think technology is going to be one of the biggest obstacles moving forward, and that perhaps this is where people will find themselves left out because they're not going to have access to it by virtue of the fact they're homeless, or they have it but they can't power it?
Yes, I think that's a very good point. And so much, as we talked about earlier, offline, has gone to paperless or internet or online, not in person, or not even written word kind of stuff, or handwritten stuff. So that's definitely a challenge for a lot of our clients. Also, they've not done it, so they don't have the confidence. So they need to be, and that's just kind of an overreaching element of our population as well. The confidence has been so tampered down for so long that it's really trying to rebuild, letting them know that they can do it. You can do this. You are worth something. You can, if we help you, let us help you. You can get there. We promise, And it might not be, everything's not for everybody. We do have a lot of clients who are in the hospitality industry because that's a huge thing here in New Orleans anyway. So the bottom line is we have to make sure that we are opening up ourselves to let them know that we are here to help and that they can trust us and that we want them to make the best of their lives. And it has nothing to do with us making us look better. It has everything to do with helping them reach their potential. And that is the second half of what Frederick Ozanam said, in my opinion, is helping people reach their potential. And like you said earlier, is it going to the classroom? Is it going to look for a job? It's also going to the doctor. Go to the clinics. I tell them all the time. A lot of them have not been to a doctor in decades. Go see a doctor. When you start feeling better physically, you're going to start feeling better emotionally, and things are going to start opening up. So,
speaking again briefly to leadership and doing this day in, day out, hour by hour, minute by minute, and I had asked you about measuring success, but again, it's hard to see someone's life completely change in one day. It's obviously an entire process, and yet people keep showing up. You still have clients. How do you, and it's going to probably be obviously a little harder for you to speak to your particular staff, but the resilience to be able to come back and do this day in, day out. And I assume there are probably many times y'all are thinking, man, are we making a difference? So how do you do it? It's obviously you have grit and your staff has grit.
Yeah.
But for you personally, what do you find has worked for you in any moments of doubt or frustration, anger, resentment?
So I didn't always, but I look at myself and I know that I am such a fortunate person. I grew up in a middle income household. I had a family. I had parents who loved me. I had siblings. we weren't crazy rich, but we never wanted for anything. And to me, it's just, I want to be able to give back of some part of my fortunate upbringing, and I just want to try and help people. And I think that's what most of our staff is all about too, and a lot of our staff have gone through, look, everybody in this world has gone through stuff. And a lot of our staff has as well. But I think that when we do see that needle move, and when that person who we housed 10 years ago comes back with a big smile on their face in the car that they bought, that's really cool. Those are really amazing moments. Or when, a client moved out, got their own place, now they're married, they have a family, because that happens too. One of our board members came through our program 30 plus years ago. He comes and talks to our residents a lot. When he came through the program, he was eating out of garbage cans. Now he owns a house and 2 businesses, and is married and he's retired from his main job that he had 10 years ago when he retired. But, it's just seeing, again, the gratitude, and the end result that we see so often with our clients, which is, it makes you happy. It doesn't always happen, sometimes it's tough. And sometimes we have to tell people they can't stay here anymore because of one thing or another, and those are hard times. That's hard when we have to say to somebody, we've given you chance after chance, and you're not compliant. You're causing problems, and that's painful. But that doesn't happen I honestly doesn't happen as often as people might think. We really, because people are grateful. They're thankful that we're here to help, and so, again, that's a gold star. That's what we're here for, to help.
I like to ask my guest about literature that has had an impact on them, or that they're currently engaged with, that they find interesting, because that's how you get to know people better and learn new things. Any particular book you're reading now, or one that's had an impact on you?
Well, you didn't ask me the impact part earlier. I love I love nonfiction, so I like to read about people sometimes too. But for the most part, for my daily reading, I usually read books that are kind of just fiction and sort of just carefree and not really kind of mindless almost. Like the one I'm reading right now is by a local guy named Chip Lococo, and it's called The Devil's Jazz, and it's about a serial killer in New Orleans in the early 1900s. And so it's just kind of fantasy. It's out there because this, like you said, this work it takes its toll,
yes.
And so when you get home, you just kind of want to turn things off as much as you can. Because I can't turn my phone off, unfortunately. But yeah, it's just to kind of escape sometimes. So I like to read books that kind of let me escape things sometimes.
Well, I appreciate the time, Ms. Blanche, and for sharing your experiences and expertise. Shout out to the audience for spending time with us. Special regards, undoubtedly, to the staff of Ozanam Inn, its supporters and donors. Also to those from Tulane and Louisiana State University that come here and provide healthcare services and dental services to Ozanam Inn's clients. So as your host, I welcome you to join us again next week, where we'll invite others to also follow, and where we provide a little extra perspective, because the devil is always in the details. Until next time.
Thank you.